Hey, Dr. Lindsey and Wendy here. We're going to give you long-term follow-up on the feminization of a transgender hairline. And we have an interview with a patient later on in this video. So we do mostly male pattern baldness. And it's some but not a lot of thinking with that. You either fix the back, you fix the front, or you fix both, and you try to do it in such a way that it looks natural. We do some female hair transplantation. The trouble for many females is that they have, by the time they get here, they have not enough hair to get the results they're going to want. And so I'm very selective on female hair transplant. And we do a fair number of transgender patients, and that requires more thought, because generally you're taking a hairline that goes with one gender and making it into another gender. And so, for example, in this patient, the patient arrived looking like this, and this was 7 years ago. Here's a close-up. Now, that is not a feminine hairline. And the patient had a number of brow surgeries and facial surgeries, and so we did a procedure to add 1,800 grafts and feminize the hairline. And what I do typically is I have Wendy, who's been with me 21 years, and I look at her hairline every day and find it unremarkable. I have her stand beside the patient and essentially draw as close as I can on the patient to as Wendy's hairline, and then we make adjustments from there. And so here's our patient at 3 years. Now, this is pretty good, and I say pretty good because no matter who the patient is, when you do the hairline, if there's a significant color contrast, and there is in this patient, really dark hair and really white skin, it never looks as thick as it does as if, say, the person had dark skin and dark hair, or gray hair and white skin. Additionally, this patient has very thick, bristly, wiry hair. I mean, it's thick hair, and so even when you plant, here's a hair root, it's like this, and so you have to leave a little space, and so even when you dense back the hairline, there's still a little extra space. So at 3 years, the patient was having some other forehead feminization surgeries done, and so we did a little tweak to add some density here and address a few other scars. And so then here's a picture at just around 5 years, and then here we are with an interview at 7 years. Tatiana, it's okay if I use your face and talk to you, right? And we're going to put this on YouTube. So I had to reshoot this, Tatiana, because we did this a week or so ago, and I hadn't shown you before pictures, which are up between you two characters right now, and you were kind of happy. And then you see your before pictures, and then you got all bubbly. And so I wanted to reshoot it. And so am I correct in that things turned out better than you expected?
Absolutely, yes.
Any kind of bullshit I pulled on you?
Nothing.
And do you feel like we treated you with respect? This is a no judgment zone. We're happy to work with you. Okay.
Yeah,
I'm going to come
she's
around.
happy to come here all the time.
And so
Exactly.
I'm going to step over there.
Oh no, let's
Scoot
see.
a little closer there.
You're getting too close.
Yeah,
So I need
so-
my space.
So people will notice that when I do a feminine hairline, I have Wendy stand beside the person getting the feminine hairline, and then we draw it. And I know you brought a friend
Yes.
who I spent an hour drawing on this person's hairline on a Friday afternoon. We were doing that, and then your friend went to the gym and washed it off.
Oh yeah.
I was ready to jump out the window. But when I look at the two of you, I think, Tatiana, your hairline looks better than Wendy's, and God made Wendy's, right?
Yes, and you made the other one.
Yeah. Okay. No, but I think it looks natural, right?
Yes, it's better. Yeah.
Absolutely.
Anything you want to tell people that might look at this?
No, that's amazing, doctor. I recommend it for everyone.
Okay. All right. Thank you so much for your business, and thanks for doing this again. Okay. So Wendy, this person is really fun person to be around. I really enjoy it when they come to the office, and sometimes they show up with a whole crew, and sometimes she comes by herself. But I mean, I won't say it's life-changing, but you and the patient were talking about how it's changed things for her. Can you go into that?
Yes, for her has, like you said, they come in a crew, and we have done a couple of her friends.
Yeah.
And Tatiana started her change later than most of them. So Tatiana had a hard time, changing to how her friends look. With Tatiana, there's not much in the hairlines and everything, it's not much of a difference. She looks really feminine. She loves it. Nobody.
So at one point, I recall talking to the patient and maybe the whole crew about with a masculine hairline and feminine gender, they either got picked on by a bunch of people, and then now as the hairlines become more feminine, that has gone away.
Yes,
Right.
yeah, that was the thing with Tatiana's friends. They, like I said, some of them friends started very, very early, and Tatiana was the one that was getting picked on
Yeah.
most of the time, and telling the girls why they're hanging out with Tatiana.
Yeah.
But Tatiana now looks just like the girls.
Yeah, because I'm upfront with the patient. That first picture, that is not a feminine hairline, in spite of brow procedures being done someplace else. But now it's an unremarkable hairline. So, I mean, that's a job well done.
Yeah.
And so we like doing these kind of cases. We like helping the people, and they are intellectually challenging. I mean, it is not brain or heart surgery. However, to do something along this line does require a fair amount of thinking and a fair amount of discussion with the patient before, and oftentimes a little tune-up a couple years down the road.
Yeah, we asked them to bring pictures to see what hairlines they like.
But inevitably it comes back to your hairline. I mean, almost always.
Yeah,
Because-
there's like little tweaking. It's not like everybody fits my hairline, but there's tweaking that you start with mine, and then they say,
Yeah.
I want it like this one and that, and it changes. But
Yeah.
it's like Tatiana's is, so I think hers is better than mine.
Anyhow, hope you enjoyed this video. If we can help you, please give us a call. Thank you.